We envision a city where all residents can flourish regardless of their race, ethnicity, income, gender, zip code, or immigration status. Dallas's leadership knows this can only happen with a community-driven plan of action to improve residents' quality of life. That means collaborating with residents, businesses, and organizations to develop and implement data-driven policies that promote equity, inclusion, and resilience. It means working hand in hand across dividing lines that have historically kept us apart. The Resilient Dallas Strategy outlines how we can make Dallas a city of opportunity for everyone. 3 notable goals are to make Dallas a welcoming city to immigrants, leverage partnerships to address behavioral health, and alleviate adverse environmental conditions by promoting sustainability. As the first certified welcoming city in Texas, Dallas has reduced barriers and created opportunities for immigrant residents by expanding language access across city services, supporting families by creating a resilience fund during the global pandemic, and offering legal services. Dallas's approach to divert people experiencing mental health crisis from jail or unnecessary hospitalization is quickly becoming a national model. It's called Right Care, with the right people, primarily a social worker, paramedic, and police officer, answering 911 calls. Mental health patients are receiving the right treatment. Dallas's award-winning Comprehensive Environmental and Climate Action Plan, or CCAP, is constructing buildings that are energy efficient, installing solar, reducing emissions, converting the light-duty fleet to be electric, and using cleaner fuel for other vehicles, protecting water resources, and increasing access to healthy local foods from urban farms and gardens. We are an all-American city and a community for all.
We are One Dallas.
We are all One Dallas.
Hola, I'm Dallas's Chief of Equity and Inclusion, Liz Civio Vega. On behalf of the City of Dallas, our incredible community leaders, and city staff, we're pleased to provide a brief snapshot of 3 of Dallas's overarching goals, which demonstrate our aggressive and intentional efforts to build an equitable, inclusive, and resilient city for all.
Hello, I'm the Dallas Welcoming Officer, Christina De Silva. As the first certified welcoming city in the state of Texas, Dallas is committed to helping immigrants bring their best to our city, providing fresh perspectives, starting businesses, and contributing to the vibrant diversity that makes our city prosper.
Good afternoon. I'm Joel Schweitzer, Regional Director of the American Jewish Committee. AJC and many other coalition partners have worked with the City of Dallas to increase community awareness about the economic, social, and cultural contributions that immigrants make.
Hello, my name is Dr. Jessica Gomez, and I am the Executive Director of Momentous Institute, a local Dallas nonprofit that collaborates with children, families, and communities to build and repair social-emotional health through education, therapeutic services, and training so all children can achieve their full potential. In response to the economic stress and trauma that the COVID-19 pandemic has inflicted on our city, Dallas has collaborated with community partners to host mental health first aid trainings for Dallas immigrant residents and community leaders. Since February of this year, 55 immigrant residents and community representatives have been trained to help their friends, families, and neighbors understand and respond to mental health issues such as anxiety and depression.
Early in the pandemic, the city worked to form La Alianza, an alliance of Latino community groups, and the African American Black COVID-19 Task Force, which is made up of Black and African American serving organizations. The city collaborated with these 2 communities to distribute thousands of masks, hand sanitizers, and public health information, such as how to access free COVID-19 testing. Thanks to our partners, the city was also able to quickly establish a network of nonprofit organizations that distributed over $11 million in rental and mortgage assistance to Dallas residents who were experiencing economic challenges due to the pandemic. I'm excited now to turn it over to the Right team.
Good afternoon. I am Tabitha Castillo, manager of the Right Care program. I'm joined today with our partnered agencies. Right Care stands for the Rapid Integrated Group Healthcare Team. We were developed to help divert people experiencing mental illness and to help with unnecessarily going to jail or being hospitalized. This program has increased equity with people with mental illness.
Hello, I'm Jessica Martinez, Chief Clinical Officer with the North Texas Behavioral Health Authority. Prior to 2018, only Dallas police officers responded to 911 calls for mental health related emergencies. While Dallas police officers received training in crisis intervention and de-escalation, they were not the mental health professionals best suited to these situations. A study by the Meadows Mental Health Policy Institute found that police response usually led to jail and/or hospitalization simply because officers did not understand patient needs or actions. Dallas recognized that police interactions involving people with mental illness may escalate quickly, putting everyone in danger, which is why Right Care created a safer response to behavioral health crisis calls.
Hello, I'm Kristen Peterson, social work supervisor with Parkland Health and Hospital System. After 2 years, of the total mental health 911 calls received, 22% of the responses were diverted from hospitals to community care, and 12% of responses resulted in jail diversion. In 2020, the Right Care team participated in over 1,800 mental health calls, follow-up visits, and outreach care visits. The number of apprehensions of people experiencing mental health crises has declined, and Parkland Health and Hospital System sees fewer mental health patients in crisis return to an emergency room.
I'm Sergeant Wells with the Dallas Police Department. Since the Right Care team has launched, we have seen a 30% decrease in mental health calls to the 911 center involving an ambulance. The involuntary commitments have also decreased by the hundreds. Each year, Right Care team has been in existence. The Dallas police community and first responders have embraced our program. The Right Care provides a dual response and approach, serving its residents in a unique emergent care for its patients. And now I am pleased to turn it over to CCAP team.
Good afternoon. I'm Susan Alvarez with the Office of Environmental Quality and Sustainability, and I'm so happy to be joined today by Ms. Temecula Dro, who was one of our key stakeholders in the development of the Comprehensive Environmental and Climate Action Plan, CCAP for short.
Good afternoon, everyone. I'm happy to be here. I was one of about 60 people who worked with the city to make sure that our community's needs and concerns were addressed as part of the climate plan. We held lots of neighborhood and citywide meetings. We provided information at churches and football games and met with other stakeholders to help them understand the project. I will be honest, not everything got in there. There was a lot of compromise all the way around, but we are moving forward. And I continue to advocate on behalf of the neighborhoods as we move forward with this plan.
Thanks, Temecula. We are so grateful for your help and honest feedback along the way. The CCAP was born from a robust community engagement effort. I think our staff attended over 200 meetings in the period of about a year, and we received plan input from all 88 of the Dallas zip codes. Most of Dallas can relate to this plan because we've had firsthand experience with our changing climate through tornadoes and hail and flooding and our spring freeze this year.
If I might jump in, I'm David Martinez, and I'm an environmental advocate. I was also a member of the advisory committee. I'm so proud of Dallas's effort of this first-of-a-kind plan in North Texas that includes targeted actions specifically developed with a focus on equity, inclusion, and resilience. The plan addresses literally everything from A to Z, from air quality to zero waste, including green space, water resources, food security, transportation, buildings, and energy actions. All 97 actions of the 8 focus areas were screened for equity by assessing potential impacts and benefits from implementation of the plan.
Thanks, David. I'm Sandy Grayson, and I chair the Environment and Sustainability Task Force that is guiding plan implementation and making sure that our community voices continue to be heard. The Office of Environmental Quality and Sustainability worked hand in hand with internal and external partners like Temecula and David and many others to develop a Dallas-centric plan to mitigate drivers of climate change, adapt to future climate conditions, enhance environmental quality, and with that, public health.
Thanks, Sandy. We are so excited to continue this journey towards an equitable CCAP implementation with our community. Dallas is strengthening resilience by providing resources, technical knowledge, and advocacy for policies that protect public health and well-being for all. CCAP actions are long-term, life-changing, and sustainable towards creating one Dallas.
The Welcoming Dallas Strategic Plan, the Right Care Program, and CCAP represent Dallas's commitment and compassion as a welcoming city, increasing equity, inclusion, and resilience. Juntos, we are making a progress towards being an all-American city. We are all one Dallas.